people to like come on. Keep in mind that in your state, if you want to track how things are going and you want a rough number, I would encourage you not to follow the number of deaths. You should follow and don't follow the number of people who test positive, because of just how we're testing it. That's not an accurate number. What I would, if you want to follow about how your state's doing, I would look at the number of hospitalizations that day, and track that daily. When you see them going down, you know that you may be adjusting that curve. And if you want to get super focused, look at the number of ICU admissions. That's what's going on real time. The number of deaths, you can track that, but that simply tells you about what happened 2 weeks ago, because those people were very likely infected 2 weeks ago. Again, if you want to find out what's going on real time in your area, I would look at the number of hospitalizations or the number of ICU visits. Hey, Jeff Bow, how are you? Ron Turner, what's going on? Michelle Bradshaw, hey, how are you all? Hey, don't forget today, Karen Porter. With the first 5 minutes, will I just be saying hello, giving everyone a chance to like come on, and then we're going to get into the updates. And for those of you all who are new to my channel or who are new to my page, don't forget. Thank you for like joining me. But we have one rule on this channel: is to be kind. That's one rule. If you can't be kind, I think Facebook says, they've got 18 million lives going on every day. There's a chance for you to listen to those other lives. But like, we are going to be kind. Hey, I just got off a night shift last night. Before you say did not change, I'm working out of state. I only bought scrubs, so I had to change into some clean scrubs. And if I'm not on my game the way that I normally am, just know it's just a tribute to me just having worked night. There was a different lecture that I was going to do today, but I think combined with what I've spoken about many other lectures about the vitamin D, I think it is important to bring this home now, because I think that there's some steps people may want to take today. Again, you've heard me speak about vitamin D in the past, and I would encourage you. There's a bit.ly attached to this. It tells you about my 5 recommendations. It even has vitamin D on there. It even gives you the main article that I use, but lately I've looked at about 5 different articles of why vitamin D is vitally important to everyone. Vitamin D is important to everyone, especially if you're black. And for my white listeners, you'll see it's not a black thing. It's a genetic thing, believe it or not. It's a genetic thing. And by the way, because this is a site about being friendly, kind, and we're all in this together. Again, we're all in this together. For my white listeners, take your vitamin D. But then for all your black friends, reach out to them, call them and say, hey, you need to be taking some like vitamin D. And shortly, you will be able to tell them why, because we're in this together. And for those of you all who are feeling a little anxious and you're getting a lot of different information, don't feel bad. Within the medical community, we're getting a lot of different information. Last night, I was on a live with hundreds of doctors, all different types from all over the country. And the one person talking was a virologist. And the same questions that you all asked me, but it doesn't make you all feel better, but it's the same questions we are asking her, except we're just using different language. And just to be sure, if it ever feels like I'm talking down to you because I'm trying to explain too much, I'm not. It's just that I need to make sure that we're all speaking the same language. Great example. As you know, I am an ER doctor. The lady last night she was a infectious disease doctor. The language she was speaking is different from how we talk in the ER. So often people in the comment would be like, what does that mean? What do you mean by that? The point is we all speak different languages. But today, or as is the case all the time, this is about helping us all get through this. This is about learning what we can learn. And don't forget, the rule is we're going to be kind to one another. That is the rule. And let me give you my ask at the beginning of this. versus later. My ask is that when you get off this live today, you call somebody. The rule is you could not have spoken to them since January, and the call has to be less than 5 minutes. And you've got to call 3 people. You call 3 people and say, "Hey, I'm just reaching out to you." And you can even say, "I'm part of a challenge. I can only talk to you for 5 minutes." But you're just reaching out and saying hello, and it's got to be less than 5 minutes. And if you tell them that up front, then they will understand when it's time for you to get off. Catrice, how are you? Hey, Michelle Bradshaw, classmate, how are you? All right. Leslie, hey, Leslie, where have you been, Leslie? Stephanie, I just got off the phone with Maury. I was talking to him when he was on his way to the office. Alvin Lee, that was a funny video that you sent me. That was funny. In fact, if you want to drop it in the comment section, I think that other people will find it funny as well. Craig Coleman, my frat brother, what's going on with you? Hey, I'm actually in my nephew's place. See that right there? Yeah. It runs in the family. Kim Lawson, how are you? Jalea, all right. Jalea, you did a great job on, Jalea is my intern. She did a great job on getting me organized. The graphics, that's her. Robert Marshall, George Lawrence, what's going on? All right, everybody, don't worry. Denise, Dawn, hey, Dr. Dawn, how are you? I know Dr. Dawn, as a radiologist, at least you get to stay in the house and read films. All right, here we go, everybody. Let's get started. Mo and Vince. Now, what I'm going to need you to do, Martina, I need people, I wouldn't take notes, but I would listen carefully because, and I'm going to move slow. We're going to start from a very broad level. And I'll tell you when I'm getting to the punch, but you've got to understand leading up to the punch. It's like a prize fight. You know, just to see the punch is not great. You want to see the whole fight. And again, this should be about 12 minutes. Still waiting on a few more people to get on. For my Hamptonians and my HBCU people in the house, hey, just give me a few thumbs up. And let me just tell you, and then I'm going to get started seriously. The beauty about going to an HBCU is that we have little brothers and big brothers. And I graduated a long time ago, over 30 years ago. And I've got a big brother. He's my boy, but he's always my big brother. Kirk Weems. Anybody from my Hampton knows Kirk Weems. He has always been my big brother. Even when I started doing these, just all my life, Kurt is always there as my big brother. He sends me stuff, helps me out. For those of us, let's give a thumbs up for all of us who have big brothers and big sisters who've just always been there for us, who've taken the spirit of that program and have really just taken it to the next level. Here I am, 30 years later, kid, grown man, Kurt Weems, still my big brother. All right, everybody, let's get started. Marvin, how are you? Hey, you're in Waldorf. All right. Jackson Waldorf. Mambos, here we go. All right, everybody. And hey, Joy, my big sister, Joy. Claudine, thank you for what you send me. And I haven't gotten any articles from you lately. I saw that picture of you in the OR. Very good picture. Natasha, what's going on with you? Frank Smith. All right, now we're going. All right, let's start off by the virus, the coronavirus. We all know that that's a virus. But the name of this virus, now follow me, the name of this virus, and I'll tell you when we get to the deep part, but just to help you with some of the lingo. The name of this virus is SARS-CoV-2. The name of this virus is SARS-CoV-2. SARS stands for Severe Acute Respiratory Syndrome. That's going to be important later. SARS stands for Severe Acute Respiratory Syndrome. And by the way, this is not our first SARS. We actually saw SARS-CoV-1 in 2003 in China. I think about 8,000 people died. We also saw it a second time, except it was MERS-COVID in 2012. It was the Middle Eastern Respiratory Syndrome. All right. This is not our first case of it. Now, the disease that we see, which is still within the virus family, is COVID-19. That's the name that we've given this. It's COVID. It is the name COVID-19. Because this is new to us, nobody has immunity to it. Nobody. That's why it's hitting us all so hard. No one has any immunity to it. There's two ways to get immunity to it. Two ways. One, you actually get the infection and your body launches an immune response and you have a immunity to it. Or you get vaccinated, for which we don't have a vaccine, okay? We don't have a vaccine to it. The death is affecting about 60% men, about 40% women, depending on how you look at the data. Blacks, as we found out last week, their mortality rate is greater. And this is where I think our racial baggage as a country, all of us, black, white, purple, green, whatever, this is where our racial baggage may have got to us. We all attributed it to the comorbid conditions. And therefore, if you have these comorbid conditions and they're more prevalent within the black community, that's why black folks are dying more. I'm sure that plays a role in it. But what if we say, well, what else could it be? There's something that it could be. Now, here we go. Follow me on this one. The way that COVID works is COVID-19, its whole goal is to take over our lungs. It wants to wreak havoc on our lungs. You get the infection, it goes down to your lungs, you mount an immune response, and boom, your lungs fill up. I'm going to go into that shortly. That's how COVID works. But how it kills us is it's an overreaction immune response. So a mild one's fine. You get the infection, your body has an inflammatory reaction to it, an appropriate one, and which is part of the immune system, and that usually fights the virus and kills it. But with COVID, you have an overreaction to it. You have there's something called cytokines. There are cytokines. That's an inflammatory response, which helps it. But with COVID, you have a cytokine storm. It's too much. It just overtakes that air. So in our lungs, you get this cytokine storm. All right, and it causes inflammation. The inflammation leads to increased fluid in your lungs, which leads to ARDS, which leads to the pneumonias and all that, and you end up being placed on a ventilator, and many people end up dying. At the end of the day, it's the SARS, the severe acute respiratory distress syndrome, that kills us, and that is an overreaction. That's our immune system in overdrive. All right, does everybody get that? That's important. Vitamin D is necessary for our normal immune functions. Why? Vitamin D does a few different things. Its production, it levels, it maintains an appropriate inflammatory response. It maintains an appropriate inflammatory response. And it causes a decrease in the pro-inflammatory response. Sounds like I said the same thing, but they're two different ways, okay? But we're going to keep it different. But we're going to keep it that way. Low levels of vitamin D, it compromises our immunity. Blacks, darker skinned people, Hispanics, we have lower levels of vitamin D. Why? Most of our vitamin D comes from our exposure to the sun. Most of our vitamin D comes from exposure to the sun. And darker skinned people just across the world, because of our darker skin, our vitamin D, the sun does not convert vitamin D as fast. It still does, but not as fast. In this country, oh, wait a minute. Let me just finish talking about vitamin D. So what vitamin D does, and like COVID, is that it reduces the inflammatory mechanism. Vitamin D, it reduces the inflammatory mechanism. Pause. Let's go back. Don't forget, how did I say that COVID ends up killing you? It's an overreaction of your inflammatory system. Vitamin D reduces that component. It reduces that component. And don't forget, COVID too, it wants to go to your lungs. That's its goal, to go to your lungs, cause that over-inflammatory reaction. And if you're vitamin D deficient, then your reaction is not in check. There's that cytokine storm. There's that overreaction. Are you following me? All right, here we go. The case fatality rates, those who are killed, they are at increased age. They have more comorbid conditions, and they're vitamin D deficient. Woo, here we go. And they're vitamin D deficient. I'm not done. Follow me. Now listen to this data. In the U.S., 42% of the U.S. population is vitamin D deficient. 42% of the U.S. population is vitamin D deficient. Does everybody follow me? 42% of the population is vitamin D deficient. Now, this is where you want to lean in. Why I had to say the and blacks part. 82% of blacks in this country are vitamin D deficient. 82% are vitamin D deficient. 70% of Hispanics are vitamin D deficient. For my white brothers and sisters, 42% are vitamin D. And the darker you are, the more likely deficient you are. Are you following me? Give me a few thumbs up to tell me if you're following me. Don't forget what vitamin D does. Let's just speak in very broad terms. It inhibits. So when there's an exposure, there's an appropriate inflammatory reaction and immune reaction. There's an appropriate. Vitamin D kind of keeps that appropriateness in check. When there's a deficiency, it makes it less likely to be in check. And by you, before anybody says, I'm not saying all and every. And the data is clear. And by the way, if you hit that bit.ly, it will give you the first article that I spoke about with like vitamin D. It will give you that first article that I talked about. Here we go. Somebody keeps texting me. That's okay. Let's just keep moving. Every immune cell in your body has a vitamin D receptor. Every immune cell has a vitamin D receptor. And by the way, we're just going to talk about very broad. We all have white blood cells, and there's many different types of cells that circulate our body, looking for foreigners, looking for invaders. And don't forget, COVID-19 is an invader. That's the virus. But it's going through looking for invaders. That WBC. And when it finds one, it launches an inflammatory reaction and an immune response. And it's got vitamin D receptors. Vitamin D, it helps mitigate that response. It keeps that cytokine storm. It keeps it from going into overdrive. Vitamin D deficiency is linked to diabetes and high blood pressure. I'm gonna say it one more time about vitamin D, just to be sure that we're on the same page. It inhibits an overreaction to the inflammatory response. That's what it does. And it provides an anti-inflammatory. It increases the anti-inflammatory response. It does two things. The end of a side. So once you have the inflammatory response, and you have too much of it, you develop what we call ARDS, which is acute respiratory distress syndrome. Because you've got all that inflammation going on around your lungs, it causes a leak. We call it a capillary leak, which means that fluid starts to spill into your lungs. Fluid starts to spill into your lungs. Hence, that's why we need the oxygen. Hence, that's why we need the ventilators, because you got so much fluid, the ventilators help oxygenate you. And there's a great study. They looked at 18,000 people, and it showed that people with lower vitamin D levels were more likely to develop respiratory tract infections. And it said that if you start off with low vitamin D levels, you were at greater risk of developing a respiratory tract infection. One study basically showed that people who were vitamin D appropriate, they were 32% likely to develop a respiratory tract infection. People who were deficient, as in not enough, they were 60% more likely to develop a respiratory tract infection. 60% more likely. I would much rather be at the 32. In summary, I am suggesting, and by the way, I would go call your doctor, call Dr. Fauci, call the doctor of the world, and tell them to disprove this. They would say, hey, that could be, but there's bigger issues that we got to worry about. I get that. The bigger issues is how do we maintain somebody on a ventilator? But this falls under my umbrella of prevention, because we are not going to be passive, because we got to be active contributors of our lives, of making sure this works. I'm going to say it again, and then I'm going to give some of my recommendations. COVID infects your body. COVID wants to go to your lungs. When COVID infects your bodies, your white blood cells, which all have vitamin D receptors, launches an immune response. And there should be a pro-inflammatory part and kind of an anti-inflammatory part. There's some, it's a certain level of that. As disease progresses, if it's not kept in check, you get an anti-inflammatory response called a cytokine storm, which is all your immune system just going crazy. It's going crazy there, it's going crazy all over. Vitamin D, what it does is it increases your anti-inflammatory response. It increases your anti-inflammatory response, and it decreases your pro-inflammatory response. Just as a side note, I may have said that opposite a few minutes ago. Let me say it again. Vitamin D, what it does, it increases your anti-inflammatory response, and it decreases your pro-inflammatory response. If you didn't get my point, I'm gonna make it again. 42% of Americans are vitamin D deficient. Vitamin D plays an instrumental and crucial role in our immune response. It helps keeps it in check, but it's also needed for it to work. 82% of blacks are vitamin D deficient. 70% of Hispanics. The darker you are, whether not you're black, white, purple, green, yellow, green, the less vitamin D you naturally make, because most of our vitamin D comes from sun exposure. Natural sources of vitamin D are dairy products, fatty fish like salmon, mackerel, tuna. All right? Those are natural sources. Oh, by the way, thank you, Kim Leah. Nothing I say should be taken as medical advice. It's just medical information. Not medical advice. It's just medical information. I would encourage you to talk to your primary care doctor. I'd be happy to share with you what we're doing in my family shortly. But 82% of you black folks and Hispanic folks, including me, are vitamin D deficient. And so I would talk to your primary care doctor. In the meantime, vitamin D, you can purchase it over the counter. It comes in D4 and D3. D3 is more active. When you take it, it's going to it's a fat soluble vitamin, so it's going to do what it's supposed to do sooner than vitamin D4. When you look it up, when you look it up, it's going to come in international units and micrograms. International units and micrograms. If you look it up in international units, buy it in international units. If you look up in micrograms, buy it in micrograms. It's similar to pounds versus kilograms. And again, for all of us, black, white, purple, and green, there's a chance that we're vitamin D deficient. For my white brothers out there, if you know you're not, reach out to some black person and say, hey, I'm going to need you to we're all in this together. There's an 82% chance that you're vitamin D deficient. Talk to your doctor. And by the way, vitamin D is purchased. You can purchase it over the counter. And, some children in this country are vitamin D deficient as well. I would talk to your primary care doctor about what the dose is for them as well. In my household, because we've got light-skinned people, dark-skinned people. In our household, what we're going to do, I'm not recommending this for you, everyone and by the way, there's 16 of us within a 3-mile radius. We're all going to take 25,000 units of vitamin D for the next 7 days. And then we're going to cut it down to 5,000 units per day. That's just what I'm doing. I've not talked to my primary care doctor. And by the way, I'm not a nutritionist, primary care doctor, virologist, none of that. Whatever you do for your family, please talk to your like primary care doctor. Oh, and by the way, if you've got kidney disease, thyroid disease, kidney stones, please be sure to contact your primary care doctor. That is it. Any questions? Let me know if I was saying a lot. Let me know if I misspoke. The one thing I did misspeak on, that I think I did, vitamin D, what it does is it causes an increase in the anti-inflammatory reaction. In the anti-inflammatory, I mean, it keeps the inflammation from going too much. And it decreases the pro-inflammatory, because don't forget, you do need some pro-inflammatory component to this, but it's supposed to be a synergy. It's when that synergy gets out of whack that you get the that you get the cytokine storm, and it wreaks havoc on your respiratory system, and then that's when you get the fluid starting to spill into your lungs, which leads to the ventilators. And by the way, the goal is not to be placed on a ventilator. The ventilator data is not looking great. Studies showing either 50 to 80% of people, once placed on a ventilator, don't come off of the ventilator. I'm not trying this on a bad note, but I say it to say, what we do now to protect our family is key. And if you need evidence of what I said, I would look at the article that if you hit that bit.ly, I would look at that article. And then there are other articles. Let me also give you can go to, because usually I'm going to update that like bit.ly, but I'm doing a series of nights, so it won't be anytime soon. Go to www.ncbi.nim.nih.gov/PubMed/322523338. That is it. Team, hope that helps. We're going to answer a few questions now. Let's get it. Here we go. Joy. All right. Hey, Gina Towns, how are you? Let's go here. Oh, and by the way, for those of you all who chimed in, now we're just doing questions. Mary Road. Here we go. All right. I'm getting to the questions here. Let me listen, because I hope so many questions you'll probably answer them during this level. That's funny, Jalea. Thank you. This is actually what we discussed yesterday. Vitamin D deficiencies. Felicia, you're right. I've been talking about vitamin D deficiency for the last 3 weeks, but now I don't say that I was right. But now there's articles that's actually talking about vitamin D and COVID-19. And by the way, I don't do any original research. I just read articles and my listservs as well. Ding. Hey, thank you, Johnny Blackwell. I appreciate that. Following you, this is great information. Joy, glad you like. Can you share the links again? If you hit that bit.ly, that gives you one link, and then I will try to drop the link to all the articles. It won't be until late tonight, because I'm about to go to bed when this is over, because I work. So while I'm working tonight, I will try to remember. But I think I just also told you that if you go to www.ncbi.nim.nih.gov, you can pull up most of these articles. Jamila Larson, how are you? Hey, and by the way, the other thing that I asked you all to like do, for those of you who like joined me late, I asked you to do something nice, or to call 3 people, and you should talk to them. I mean, and you're calling someone to like just say hi. The conversation is supposed to be less than 5 minutes, and it's got to be someone that you've not spoken to since January, at least. And the other nice thing for those people who still have paychecks, because many people still don't, mainly your government employees, charities are suffering. So I would encourage you to still give to your charities, even if it's small. Still give to your charities. Those in the Washington, D.C. area, there's a children's playtime project. It takes care of 94% of the homeless kids in the Washington, D.C. area. 94%. They still need, it's called children's playtime. All right, what's up, man? Any suggestion on how you give a friend in the hospital on a ventilator dealing with? Any suggestion I can give a friend? I don't have a suggestion. My heart goes out to you, and I know that you're probably not allowed to be by their side. So I would just encourage you to like pray. There's not a suggestion that I can. There's not really one that I have to like give. I am so sorry. Yeah, there are different types of vitamin D. There's vitamin D. There's vitamin D4, vitamin D3. I'm not an expert in that. We are taking vitamin D3. That's what we're taking, but we're going to up our dosages. But we're taking vitamin D3. Veronica, good job, good job. Ken Horton, all we need in PPE supplies. The answer is yes, but more importantly, what we're in need of is the sanitizer wipes. We need those. Every hospital is different, and I would encourage you this: if you're trying to give something to your hospital, don't call the administrator of that hospital. Call the ER and ask to talk to the doctor or to the charge nurse. They'll tell you the truth about what's going on. The administrator, I'm not knocking them, but I would just say those who are on the ground interacting with that patient, they will say, hey, we need this, this, and this. There is still a shortage out there in many areas. Thank you for that question. Krista, you take vitamin D, D3, good. Hey, I appreciate that. Daniel, I take 5. So you're asking me the micrograms. Again, it comes in international units or micrograms. I use the international units. Good job. Takesha 4, what's going on? All right. And then the idea of gargling. Yes. I've not heard the gargling with that salt water helps with anything. I've also heard this thing about 5G. Stop talking about it. Stop even thinking about it. Doesn't matter. If you really think about it, whether or not the thing is 5G, it starts from 5G or like 10G, it doesn't matter. It's killing folks now. And I'm flippant about it because I get more questions about that. And in my mind, I just because of how I view the world, it doesn't matter. It's killing us now. So how do we stop it? But thank you for like bringing that up. Johnny Blackwell, yeah, bro. With the high doses for those kidney issues, the recommendation is to start to take to keep the calcium from stagnating. Hey, Johnny Blackwell put a comment in there. If you all look through the comment, I'm not sure what that means, Johnny. Probably because I am multitasking, but there we go. How accurate is the COVID test? Oh, I told my doctor that it had an actually rare temperature. Let's talk about the COVID test just real quick. Real quick. We're going to talk about the like COVID test. We're going to take the mystery out of it real quick. I'm going to talk about this in big, broad strokes. There are 7, what I learned on the physician's call with the virologist last night, there are 70 vaccinations that they're working on. 70. And in the end, one will win. As it relates to the test now, there are 2 tests. Look at them in very broad categories. There's a PCR, which is a nasal swab. That one comes back in 15 minutes. They take a Q-tip, go in the back of your throat or like down your nose, and they swab. That tests for antigen. Let's just define antigen. Antigen it's the virus. It's what we're fighting against. So they go in the back of your throat, they swab it, and they test that. If it's positive, it means you have active COVID. You have active COVID-19. You are infectious and you have it. If you do not, if you test negative, it only means that you don't have it right now. It has nothing to do with what happened in the past. It has nothing to do with what happens in the future. Follow me. Then there are the serology tests. Those are the blood tests. They test your plasma. What they're testing is, they're testing for antibodies. Antibodies are your immune response. Antibodies are what it's what your body responded to as a result of seeing the foreigner, the virus. It's IgM, IgA, too much. When you take the blood test, it's testing to see if you have antibodies. If you have antibodies against COVID-2, what it says is, hey, you've been exposed. Your body launched an immune reaction, and because you're still sitting here, your body launched an appropriate immune reaction. The general thinking is you cannot get reinfected. You are the group of people who we're going to try to get back out into the world. And by the way, just as a public service announcement, the Food and Drug Administration, they are asking for volunteers who believe they've been COVID positive to give blood. They're going to use your blood in some study, and they've already started doing it, where they're going to use the antibodies from your blood and put them in the sickest of folks. Back to the serology test. The serology test, the blood test, it just says you've been infected and you've launched an immune response. It tells you nothing about active infection. Oh, you say, well, I'm confused. You just said I've had an immune response. If you don't have antibodies, it doesn't tell you anything about active infection. Why? Because it's only testing for antibodies. Part I did not tell you about is once you get infected and your white blood cells are launching their immune response, they're getting the fellas over because they need some help. The fellas are the antibodies while they're getting them. There's about a 1 or 2 week lag period in there. There's a 1 or 2 week lag period. So if I test you on March 1st and you don't have any antibodies, you can still have active disease. That's why technically you need both tests if you don't have antibodies. Let me say it again. If you have antibodies, you're good. Nothing to worry about. You don't have any active disease because you've got the antibodies in general. But if from that blood test you don't have any antibodies, we don't know if you have active disease. That test does not touch for that. That test does not test for that. At that point, if we were doing things maximally, you would then get a swab. And based upon that swab, you could draw some conclusions. Hopefully that helps. Sounds like a lot of I was thinking vitamin D, good blood, bless you. Hey, Stephanie, yeah, good. And Stephanie, yes. Yes. All right. Oh, how long are those who are asymptomatic never develop symptoms? Oh, great question. We dealt with this. The virologist dealt with this last night. For those people who are asymptomatic, you are, and this is so unfortunate. I used to say that you were most infectious the first 3 days from being infected. You're most infectious the first 1 to 2 days. The first 1 to 2 days. Once you acquire the infection, you're most infectious then. That's true for those who develop symptoms and who do not develop symptoms. That's the scary part. From the moment you get infected, you're most infectious the first 2 days. That's why you assume that everyone you come across with is COVID positive. You assume that about everybody. There's no, I don't know. The only way you know whether or not they're COVID positive is they show you your serology test. Hey, here's my blood test. I've got the antibodies. See my IgM and my IgA levels. All right. Yeah, I assume that everyone's COVID positive. Thank you very much for that question. All right, good question. Is there any harm in having too much vitamin D in your system? My sister says vitamin D to her excess of vitamin D. Yes, there is. It causes kidney problems, kidney stones, a number of other issues, which is why I said, don't take this as medical information. Don't take this as a medical advice. Just take it as information. I would talk to your primary care doctor. I would definitely talk to your primary care doctor. There are some other disease processes that you may not want to take vitamin D. Again, I'm not an endocrinologist. Good question. Devin Mack, what's going on with you? All right. Can you say how much vitamin D you and your family are taking? Kizzy, that was a smart way of doing it. For me and my family, and we don't have any kidney issues, and we don't have any conditions where where vitamin D is not recommended. Forgive me. When I'm tired, I stutter more. But my family ranges in age, all 16 of us, from the age of 7 all the way to my mom being older. But the adults are going to take 25,000 units of vitamin D3 for the next 7 days, and then we're going to cut it down to 5,000 units. But that's not what I'm recommending for you. I'm recommending you talk to your primary care doctor and decide. Vitamin D, by the way, it's over the counter. People keep asking about vitamin C. I've heard some information about vitamin C. I just have not read any definitive information where vitamin C, I've just not heard enough academic information. It came up on our call last night. No one came down one way or the other on it. Sharice Jones, what's going on? If someone has the link, you can put it here. Hey, Sharice says if you've got the link, drop it in the comments. Thank you very much for that. Justin Caroline. All right. People keep asking me about the immunity thing. I got my diagram, but it messes. All right, just real quick. Follow me on this one. All right, we got the diagram. Here we go. We all have white blood cells. We all have those. Those are going through our bodies. Those are circulating through our body. It's just saying, hey, it's looking for foreigners. A foreigner is an antigen. We can call that the virus. The foreigner is the antigen. The WB, the white blood cells, and there's many different types that are just naturally going through our bodies. When it comes across an antigen, it says, oh, there is an antigen. And so once it sees it, it goes and grabs it. And it calls its boys. It says, hey, white blood cell boys, gather up. And through a host of cascades and 1,000 different processes. And by the way, there's a whole specialty on this. So I'm making it really simple. As a result of that, our body produces antibodies. Call the antibodies kill the virus cells or kill the invader cells. But it takes 1 to 2 weeks to develop antibodies. Does that make sense? We all have white blood cells. There's an appropriate reaction is necessary. As it relates to vitamin D, even with the appropriate reaction, too much of a reaction is the issue when it comes to like COVID. Our immune system goes into overdrive. There's a cytokine storm. There's an overactive immune response at the lung level, which causes fluid to leak. It causes an infection, like a viral infection. And once that viral infection gets worse, it causes what we call acute respiratory distress syndrome. All that means is that the body and our fluid starts to leak into our lungs. We're not able to exchange oxygen. That's why you're placed on a ventilator to help exchange that oxygen. Makes sense? But the whole goal is not to be placed on a ventilator. I'm not saying you're not going to come off, but if you can keep from being placed on the ventilator, that works. I appreciate that, Ellaby. That works. All right, makes sense? Good job. All right, good job. Thank you for this, man. Hey, no. My doctor told me much the same. Let me know what 30% that your doctor's wrong about. I'm just playing. Glad you. Hey, by the way, you all can talk to everybody you want about COVID. One thing that is clear is that it's new to everybody, and I would encourage you. Anyone who has absolute knowledge about COVID, I would just probably run from them. The physician listserv that I'm on are the best doctors in the country. And to hear us talking, we're trying to figure this thing out. We're trying to figure this thing out. In fact, information I told you when we first started this 6 weeks ago, it's no longer true. Not because I was lying, it's just because the information is changing. And to make you feel better, what I learned in medical school 30 years ago in the New England Journal of Medicine, 30 years ago, about 80% of it's no longer true. Medicine's changing. What's changing now is this. This is changing in lightning speed. All right? Any recommendations for a DIY mask? I don't know what that means. Hey, someone sent me a picture of asking me which mask is better. I will be upfront. I'm not a mask expert. What I've said is, ideally a surgical mask from the hospital for laymen, and then an N95 is best. An N95 is. I am still not recommending N95. Why? Because for the same reason why the CDC was very slow to recommend masks. If you recommend masks to 340 million people, 340 million people go out and buy a mask, and that puts us at short supply within hospitals. And by the way, no one tells you this, but if you have a mustache or a beard, it compromises your mask. Why? Because your mask doesn't fit as well, and therefore it does not serve as well. I didn't say shave it off, but even when we're being fitted for our N95 mask, and by the way, prior to COVID, when we got N95 masks, we had to be fitted for it. A professional came and fitted for us. They spray around us to see if we could spray it. But if you had a beard, you had got a different kind of mask, a different type of thing. It's called a papper. I just said to say, people with beards, be careful. Thank you very much for that. Any link between obesity and lack of vitamin D? Many of these people are passing away. Oh, Satrina Boyce, great, a very good question. Now, this is me, okay? This is me making leaps. This is not, I have not read this. But this is fact. Most of our vitamin D comes from sun exposure. I believe, and I humbly say this, that obese people, especially the more obese you are, the less likely you are to be, and I'm not stereotyping, the less likely you are to be out there running and jogging and working out in the sun, and therefore creating more vitamin D. Intuitively, that makes sense. But by the way, it makes sense to me with people with chronic lung conditions too, or chronic conditions. Because of their illness, it makes it less likely for them to be in the sun, and therefore they're not producing much vitamin D. In theory, Satrina, that makes sense. I don't have any factual evidence. You all just heard me think it through. But thank you very much for that question. Gary, what's going on? Christine, how's it going? Christine, I hear you met Jalea. Thank you very much. I'm a vitamin D deficient, but I don't realize. All right, very important. If you could please, when doing the question and answer, read the question and answer. Okay, I will. Okay, I will. Patricia asked me to read the question that I'm answering. I will. All right, I'm friends on Facebook with a mom who has a son with leukemia that gets tested regularly for different virus living in the body. And he always tests positive for it because it's just in his body, kind of like the common cold. Is that the case? How would we do if we truly have it? My pause is because I don't think I understand the question. But let me back into it. Chicken pox. If you've had chicken pox and they 20 years ago, and they test you for it now, what they're testing you for are the antibodies to it. That's what they're testing. So it makes sense that your friend's son tests positive for the same thing. That's different from, okay, maybe this gets it. A test positive, an antibody test, is different from testing for active disease. Does that make sense? So you may test positive, like chicken pox. I would test positive for chicken pox, but I had it when I was 12. But I have no active disease. I hope that makes sense. But that's well outside of my wheelhouse. Thank you very much, Stephanie. Geoff, are these antibody tests accurate? Sounds like they are just being wrote up. Don't know. Great question. I would say that because they're going. I know a few people at the centers where they're being done, and I would say I would probably lean into yes. Why? Because they've already started to take the plasma of those people who were COVID positive and they had antibodies. They're using their plasma in the most critical ill patients now as a study. Therefore, that would lead me to think that there is some accuracy to them. Let's be very clear. While we're in this crisis, the federal government, thank God we're in this country, they're not going to do any let's just try this. Let's just try that. They will still not do things that just immediately put somebody at risk. There's a bunch of protocols in place, so forth and so on. Hopefully I hope that helps, Stephanie. Adrian, so what? Adrian Jones, so what do hot water and lemon and high tea? It makes you feel good. But if you're talking about hydration, real quick, if you're talking about why it's important to stay hydrated, hit that bit.ly again, and it comes with a resource. Staying hydrated is key. Well, I wish I had thought about this so I could tie it in better, but why is staying hydrated key? Our respiratory system, it naturally produces mucus, a thin layer of mucus. It helps serve as a filter for bacteria, it helps our lung functions better, helps everything go smoothly. We naturally produce a nice thin layer of mucus. And that mucus is moved around by something called ciliary bodies, also known as, let's call them just like little hairs. We naturally produce a thin layer of mucus. When you're dehydrated, you produce thicker mucus. It's harder to move that mucus around. That's why staying hydrated is extremely key. Does that make sense, Adrian? What role is, if any, does hydration play with it? Hey, I just said it, Bonita. Great, good job, Bonita. Can you talk about sickle cell? And I take care of sickle cell patients. I've not done any reading as it relates to sickle cell and COVID patients, but one thing that we know is that sickle cell patients should always stay hydrated too. Charles Edwards, Jill Fannin. Dana is watching. Jalea dropped the bit.ly for the kit. And by the way, if you get the kit, at the bottom of it, it's got many of the articles that I am quoting. Again, many of the articles that I am quoting. And by the way, just on a different note, let me just pause. Many people are feeling very stressed, and I get it. It's a stressful period of time for everybody. Don't feel alarmed. Don't feel different. And when you get scared, bear in mind that 97% of us will do just fine. 97% of us are going to do just fine. It's that 3% that is concerning. And while 3% doesn't sound like a lot, if they're your family members, if they're your friends, if they're your loved ones, if they're your best friend's mom or dad, but by and large for you personally, 97% of us are going to be just fine. But I would say don't get stressed, because stress, real quick, stress hurts you. It helps you. It hurts you from. It makes COVID more. It gives COVID an upper hand on it. Let me tell you why. Just like real quick. We naturally secrete a hormone called cortisol. Cortisol is known as a stress hormone. When you secrete cortisol, or when you're chronically stressed, or you are in fear, stress or fear, you increase your levels of naturally occurring cortisol. Elevated levels of cortisol causes transient decreases. It causes a transient decrease in your immune system. It causes a transient decrease in our immune system. Don't forget, what we are doing now is we're maximizing our immune system. Last thing we want to do is cause any transient decreases. And I want to say this again, and for those people who own vitamin companies, all that, you cannot boost your immune system. All you can do is make sure it functions optimally. In other words, if your natural immune system is right here, if that's your natural immune system right here, there is no taking it up here. There's no medicine that does that. So if this is natural, now what could happen is that we can retard it and make it more deficient, meaning that we can cause it to go down here, and I wouldn't put any scale on that. We can do that by by smoking, lack of sleep, stress. There's a number of different ways. So you can help it function maximally by getting plenty of sleep, so forth and so on, and making sure that you've optimized your vitamins. Just so happens the only one that I'm recommending is vitamin D. It's not boosting your immune system. It's just making sure it's functioning optimally. And again, I will say, there's no such thing as boosting your immune system. You just want to make sure it functions optimally. So if you're already functioning optimally, there's no medicine you can take that'll make you go up higher. It's just real talk. All right, great. Thank you for that question. Did I finish answering? Yes. There is the correct link for those who would like to be emailed. Links mentioned before. Oh, thank you very much. Thank you, Jalea. What if you're vitamin D deficient? Thank you, April. April's asking, what if you're vitamin D deficient? I would recommend you talk to your primary care doctor or talk to your doctor and talk about starting over the counter vitamin D. But vitamin D right now is the most essential vitamin that you and your loved ones can take. It's the most essential one. Medicine, the science, the articles have actually proven that. Gina Towns, if you are asymptomatic, how long are you contagious? How many ICUs of vitamin D do you have had pneumonia, bronchitis, or pleurisy? Are you at greater risk? Okay, great question. Let's do it. Asymptomatic and symptomatic. In theory, studies have shown, so it's not in theory, you are usually infectious from 0 to 14 days. 0 to 14. That is true for asymptomatic people as well. You are most infectious the first 1 to 2 days. By and large, you develop symptoms at about the 5 to 7 day mark. Then you start to become less infectious. I didn't say it went away, less infectious at about the 5 to 7 day mark as well. You start to become less infectious at about the 5. For those of you who know me, if you could not text me now, I would greatly appreciate it. And then as it relates to how many ICUs of vitamin D, I think you're asking me how many international units. Well, just in fairness to you and to that question, I looked at a bunch of different journals. One of them was recommending 1,000 units. The other one was recommending 4,000 units. The other one was recommending, if you are deficient, to take 10,000 units of vitamin D to rapidly increase, followed by 5,000 units of D2 and D3 a day. It's all over the place. I'm choosing 25,000 units just for my family. But in terms of what I read, the maximum amount that I've read was 10,000 units of vitamin D. It didn't tell you for how long, followed by 5,000 units daily. And then as it relates to your question, if you've had pneumonia, bronchitis, or pleurisy, are you at greater risk? It depends. If you've had pneumonia, bronchitis, and pleurisy due to a regular bacteria or virus, no, because you had it and you're cured. But if you have had those things because of some underlying medical condition like an autoimmune disease, then yes, you are at increased risk. It depends. But if you've had pneumonia in the past and you were treated and cured and that was it, you were just exposed to it, you are not at increased risk for COVID. If you have pneumonia, active pneumonia now, yes, you are at increased risk just because whenever you have an active disease, you are generally at your immune system, you're more susceptible. But hopefully that answers your question, Gina. And Gina, you're my big sister back in Hampton. A few more questions, then we're going to jump off here. During the season, with those with severe allergies can be yes, those with severe allergies can be misdiagnosed. My daughter may get misdiagnosed. Yes, it's very fair. I don't mean to scare anybody, but when we diagnose you in the ER and send you home, and 90% of ERs, 99% of ERs across the country, that's a clinical call. Meaning that we're saying based upon your symptoms, based upon your history, we think you have COVID. Now, here's the sad part. It's hard to distinguish. I don't think there's anybody out there who can clearly say, who can 100% say they can distinguish between COVID and the flu. Is it a chance that with your sciences that you'll be misdiagnosed? Possibly, yes. And by the way, COVID in this country, different from China, and what I learned last night, I used to think it was just diarrhea, that was a symptom of it. But now what people are saying across the country, no paper, this is just on physician calls, physician listservs, stomach pain, abdominal pain. A lot of people are presenting with, well, many people, I'm not going to lie, many people are presenting with abdominal pain. And in my next session, we're going to talk about, if you have a fever, the signs and symptoms of COVID-19 are cough, shortness of breath, body aches, diarrhea, fever. Not necessarily in that order. The current recommendation is to home treat. I encourage you all to look at my live from April 15th. It will talk to you about how to home treat with COVID. But 95% of us will treat at home. This is why you don't want to come to the ER. And don't forget, I'm on the front lines. I'm working. And I like how the doctor in New York talked about it. If you don't have COVID and you come to the ER, you could get COVID. It's that simple. It exists on surfaces. And I would love to say we clean, but it's impossible to clean every single surface. There's a great study that just came out that doctors were tracking COVID throughout the hospital from their shoes. I say that to say, if you don't need to come to the hospital, don't come. But the most important sign, now you all lean in on this one. The most important sign you want to watch for, by and large, is the shortness of breath. I'm going to paint a bit. Why? Because the shortness of breath worsens. Don't forget, this whole lecture was about COVID. The whole goal of COVID is the lungs. Get to those lungs and recap it. Shortness of breath is a symptom that you want to watch for. If you have worsening shortness of breath, and it worsens, that's your signal for, do you need to go to the hospital? Do you need to go to the ER? And when I say, when in doubt, go to the ER, but going to the ER has its own risk. The shortness of breath is something you want to watch because it's a shortness of breath. That's a sign that you may have pneumonia. It's a viral pneumonia, and which is a sign that your body's mounting an immune response to it, which is what we want. But don't forget what we talked about. There's this dynamic. There's an appropriate immune response, which is what we want. But then there's an overreaction immune response, which is too much, which is how COVID is killing us. An overreaction immune response. and causes damage to that lung or to those lungs and causes fluid to leak in. And when fluid leaks in, you're not able to exchange oxygen. Therefore, you need a tube placed down your throat or placed on a ventilator. And by the way, the tube is not the first choice. They can try oxygen first. And if that doesn't work, then it's a tube. It's an intubation and a ventilator. For those of you who are joining late, the reason why that is so important is because the vitamin D, the vitamin D is efficient. I mean, it's helpful. Disclaimer: I'm a board certified emergency medicine physician who's working on the front lines of seeing patients in the ER. I'm not seeing patients in the clinic. I am not doing bench research and bench studies. All of my data, all of my information is coming from about 3 or 4 different sources. The CDC, the WHO, listservs of physicians, Dr. Fauci, and FaceTime calls that physicians are doing across the country. None of it comes from social media. None of it. And back to my stress part. I was cut off. Those of you who are stressed, I would encourage you, don't watch so much of the news. It's stressful. And if you're going to watch it, say, okay, choose a time of day to watch it. Make it in the evening. Make it in the evening. And only watch about 15 or 20 minutes of it. Don't watch too much time of it. And if you have kids, make sure they don't watch too much of it. Why? And I have an article coming out about this. Our ability to cope, our ability to deal with stress comes from a part of our brain called the prefrontal cortex and the amygdala. That's a part of our brain. In kids, adolescents, even young adults, it's not fully developed until they're about 21 or 22. Therefore, they don't have the same coping skills as we do. It's not fair to expose them to what we're seeing and what's going on. I think I shared you all that story about my son, just real quick. And like, if you heard it, just turn to just like bear with me. My son is 13, real boy, real dude. I was getting up, I had to wake up till I go to work. He came and laid on me. He doesn't ever lay on me. So I'm like, all right, what does he want? He was like, Daddy, don't go to work. I was like, why? He says, because, people are dying from that COVID thing. I said, oh, but, it's going to be all right. Then he goes, I heard an ER doctor died. I paused. He says, so Daddy, I don't want you to go to work. And so I was like, where is he getting this from? And so what I realized was that he had heard me on the phone, getting ready for interviews and preparing for these lives. He had seen that. And he doesn't have the same coping skills. But just to finish that last story, so I said, son, I got to go to work. Daddy's going to be fine. He said, Daddy, I don't want you. I said, Geoffrey, you know your Xbox games and all those things like you do? He goes, yeah. I said, Daddy, but if I don't go to work, I can't pay for those things. He paused. He popped up and said, Daddy, you'll be fine. You'll be fine at work. True story. I say that for humor, but I do say that I learned a lesson. Don't expose your kids, if you don't have to what's going on. They don't have the same coping skills. Lavette, what's going on? Pamela, Jessica Tuck, can you talk about sickle cell and trait? I'm not informed enough about it to just talk about it just off the cuff. I treat those patients, hydrate them, oxygenate them, and send those home who I can send them home. But I'm sorry, that's just not my area. But thank you for asking. Is your family going to take that dose of vitamin D per day or per week? Wow, Kim, you are pressing me. Kim, we're going to do that. We're going to do that per day for the next 4 to 5 days, and then we're going to cut it back. I don't recommend that for your family. That's just what I recommend for my family. But talk to your primary care doctor. But thank you for asking that, Kim. How did you discuss hydrochloroquine and lupus and COVID? No, I didn't. I don't use that. I don't know enough about it. Don't know enough about it. I was tested and was told that the accurate rate was 60%. Thank you. All right, everybody, we're going to get off of here. If you're on the ventilator, are they infused with vitamin C, vitamin D? I have not read about that. When I place a patient on a ventilator, I'm not thinking about vitamin D and vitamin C. When I placed you on a ventilator, there's an urgency going on, and vitamin C and vitamin D at that point in the ER is not something that I do. Those patients, when they go to the ICU and it's longer managed care, then that's when that would come in. But thank you very, very much for that question. It's on the CDC website. Can you speak about reinfection? There's these. Oh, let me talk about two things. Then we're going to roll. For the fever, if you're going to treat the fever, you can use Tylenol or Motrin. Tylenol or Motrin. Before you say it, you're going to say, well, I heard Motrin and I read. We talked about this last night. A bunch of doctors, about several hundred of us. There was one study. There was in Italy. There was an Italian doctor who took care of 4 patients and thought that when he gave them Motrin that they suddenly declined. That went viral. Then the British Journal of Medicine wrote an article about it. But currently the CDC, currently the WHO and our government still recommend the use of Motrin. If you have any doubts, just use Tylenol. If you have any doubts, just use Tylenol. As it relates to reinfections, there are studies that are coming out of China that says that some people who were tested positive and then tested negative and then tested positive again. On the medical side, what we're thinking is user error. Meaning that if I take a nasal swab, if I'm not the same one testing you, and I don't put that nasal swab all the way back, then you can very well test negative. In other words, if I do the swab, I go all the way back and it tests positive. Okay, cool. A few days later, I come back and somebody else does it. I don't put it all the way back. It can test negative. And then someone does it a third time. It goes all the way back again. It's positive. So is it user error? Perhaps. We don't know. But it would be behaving like anything we've ever seen if that is the case. Hopefully that helps. Carmelia, all right, Edie, we're going to get out of here. San says, I always say that the virus is like building an airplane while flying. I just hope it gets fully built and flying at maximum speed out of this thing real soon. I do agree. It's, thank you. Easy Rod, what is going? After listening, if this makes sense to you, lean into it. If it doesn't, don't pay any attention to it. If I could have one thing, if I could have my family tested, I would like for them all to test positive on the serum. I would like for them all to test positive. I would like for all you all to test positive. Because what that means is you were exposed. You had it. You're fine. You developed antibodies to it. Now you're good. Now you're good. In other words, if you get tested and you get these serum tests and you have antibodies, woo, you are good. That's why testing is so important. I'm gonna wrap this up. Wrap this up with the 4 things that we need to do absolutely. Number 1, wearing a mask. Wearing a mask is key. Wearing a mask is key. A mask is better than no mask. Ideally, it's the hospital masks that are better. The N95 is best. A mask does 3 things. It protects you against 3 things. A mask protects you from other people. All right, it protects other people from you. It protects you from other people. It protects you from other people. 1. It protects other people from you. It protects other people from you. And 3, a mask protects you from you. Meaning that the second most common way of contracting this is you touch a surface that's infected with COVID. and you reach up and you touch your face or your mouth. And you can get it through your eyes. You can get it through your eyes. When you have on a mask, you're less likely to want to touch your face. Mask, 1. 2, wash your hands. Hand sanitizer and gloves. Hand sanitizer and gloves. This is what's different for me than what people recommend. Gloves throw me off. When I wear gloves, I self-contaminate. I contaminate everything. I'm touching stuff. I'm touching stuff in the grocery bag. When I don't wear gloves and I have my hand sanitizer, I am constantly washing my hands. I reach up and touch that on the shelf. I'm washing my hands. This is when I'm at the store. I reach up and I touch that. I'm washing my hands. Wear gloves, but be sure not to cross-contaminate. All right? Gloves, hand sanitizer. 3, social isolation, social distancing is key. Social distancing is absolutely key. If you do those 3 things and you quarantine and you wear your mask, it is a great likelihood that you will not contract COVID. It is a great likelihood that you will not contract COVID. And if you do, you're going to be okay. And let me tell you why. How many of us have been through stuff in our lives? Stuff we didn't think we were going to get through. Stuff we didn't think we were going to make it. Come on. All right. So I'm the only one because I got no hearts on that one. Nobody's been doing it. We've all been through our own little drama, our own little stuff. It's happened to all of us. The fact you're here now says that you got through it, right? The fact that you're here now means that you got through it. You're going to have that kind of faith. You're going to get through this too. Even if you develop COVID, you're going to get through it too. 97% of us are going to be just fine. 97% of us are going to be just fine. I leave you today. Be nice to somebody. Write a letter to somebody. Call these 3 people. Have less than a 5-minute conversation with them. And tell them that Dr. Geoffrey said that you can only talk to them for 5 minutes. And you cannot have spoken to them since January. So your girl who you talk to every day, she doesn't count. And what's most important is to be somebody nice. Is to do nice things. And for those of you all who still have jobs, who have guaranteed paychecks, continue to give. Our barbers, our hair people, our cleaners, whoever you have, they're not getting paychecks. If you still have a paycheck, even if they're not coming for you, I think it's called your social obligation. This is my 2 cents. Be safe out there. Thank you very much for listening, and I will talk to you all very soon.